hygiene options, you can switch those out for some healthy choices. You can encourage them to take the stairs. We did a program which was we did an Appalachian Trail Challenge, so you go out, walk, you track your steps, and you would kind of record that until you did the Massachusetts section of the Appalachian Trail and walk around the country if you chose to. And the stair challenge is the same thing. You can give people points for how many steps they actually climb. But again, just a little note that says, you can burn this many more calories by taking the stairs. It's a good thing. Awareness and educational classes offered on company time, brochures, videos, posters, lots of opportunity and different ways to think about how to do this. Along with behavior change, we know that information and education doesn't necessarily change people's behavior. They need that next step and that help to do it. So, if you're trying to get somebody to start use a chronometer and track their steps, and you can offer a gym membership or, a discount to a Weight Watchers or something like that, that will help them to be successful with their behavior change. Tobacco cessation, same thing. Sometimes employers will offer free or subsidized screenings, so they'll bring a vendor in to do a biometric screening where you get your cholesterol and your blood pressure. Those are great events. Make sure there's a counseling component with it. You don't just want to give an employee a number. You want to make sure they have an opportunity to talk about what their numbers are, because that is really what's going to be the most engaging to them. And then coaching. Some companies, we had a small company out in the Berkshires with 14 employees, and they wanted coaching for everybody. So we use nurses, but there are health educators and coaches out there that can go in, and really it helps that employee take the next step. Wouldn't it be nice if we all had a life coach? And then those policies are almost stepping up to be one of the most critical. Because without a place that you can start to practice and have that opportunity to do these things, sometimes they're going to fall apart. You start your Weight Watchers and you try to bring your lunch every day, and you go to the vending machine because you forgot it, and all you see are ham and cheese sandwiches in there. Things like that. You need to start to look at your culture. So policies can be reduced healthcare premiums. You can give employees work time to do things. You can look at your tobacco use policies, whether you're smoking, non-smoking, what you do with that. Even having an employee assistance program is a work policy that actually will help an employee if they have a mental health crisis. We tend to only use EAP when we're in crisis mode, but EAP used early can awfully avert that crisis. So again, it's nice to have it, but how do you communicate that? How do you tell your employees you have these services for them? Managers training. Where the rubber hits the road, there are managers on the front lines who are helping our employees every single day. And managers would benefit with, I think, oftentimes with some training. And we've actually had managers who, if they say, the boss is telling me you guys have to do this today, and that's how it's communicated, instead of, this is going to be a really good thing for our team to do, how do you think we can do it? A manager can make or break your program. Again, making healthy food choices the easiest choice. And then looking at the equipment that you use to reduce the ergonomics. Now, I come from a health system, and I know that our number one injuries were nurses and backs and shoulders and knees, and the environmental services folks. The companies that you guys are likely in or involved with, they might be construction, there could be all different kinds of manufacturing businesses. You need to look at, what kind of safety protocols you have in place, and employees are great people to have on those kind of teams to look at that. Sometimes wellness programs will just become and spin out of a safety team because of that OSHA ergonomics connection. Again, you need to get 33% of your employees to be in the program, and you have to have documentation to support that. So, if you're a small business, that might not be so hard to do, but you need at least that amount to kind of start to develop this evidence-based program. And they're going to be early adopters. Those are the people that sign up right away, they do anything, they're the joiners, I'll do it. And that's great to get those folks, and you think those are the people that are healthy. The healthy ones go first. But that's not necessarily true. And when we launched programs like this, there were a lot of healthy ones in the first round, but a lot of them had health risk as well. once you start to create that little culture in your organization, more people will join in. But that's a requirement that you have 1/3 right off the bat. So the online process, the DPH is ready to go, they say at 9 o'clock today. The online process is up today. And interested organizations are going to need to go in and do that application to receive that seal of approval. You can get a lot of information at this mass.gov wellness tax credit. And is that on the list?
Yes.
Yeah.
It is, and this website has a guidance document that completely outlines much of what Bobby said, but actually in significantly more detail. It has a link to the Model Wellness Guide, which we will talk about in a few minutes as well. It also then will have the application process, and in the Model Wellness Guide, there are, I don't know, I'm making up this number, but I want to say close to between 8 and 15 pages of resources and oodles of information on all this, as well as lots of links to various information. But it will completely walk you through the step-by-step process on not only what you need to do, and then more importantly, how you need to apply.
And there's a place where you can go if you have questions.
That's
that
correct.
you need to ask.
And there is a website, an email address on that webpage. If you have questions, it goes directly to a responsible person within the Department of Public Health who will get back to you, and that person's dedicated for responding to questions around the wellness tax credit.
Okay, so I'm not going to do the model guide right now because you're going to be taking that, but we wanted a couple, somebody was interested, you can go to the next one.
Okay.
I'm not going to skip right over that. With regard to the final rules on the employment-based wellness programs that actually just came out of the Department of Health and Human Services. Yeah, so this is 135 pages. So I've tried to summarize it for you. There's a lot of reading. I guess the basics of it is the intent of this employment-based wellness program rule was really just to make sure that everybody, any employee in a company, if you're going to do give an award or an incentive, that cannot be based on how healthy they are. So if somebody has a high BMI, we want to make sure that it's non-discriminatory, that employers or health insurers or health groups are not making decisions around who gets a reduced benefit based on a health risk factor. There needs to be multiple opportunities for employees to try and to meet those standards. So this is, we've had a lot of these rules around since 2006 when the HIPAA wellness rules went into place. So it's not a lot different than that, but it really divides wellness programs into two different kinds: participatory wellness programs and health contingent programs. And it takes it down and it further breaks it down in the health contingent world into those that are activity-based and those that are outcome-based. Just put that. The bottom line is that you cannot discriminate based on a health risk factor. And if an employee needs or is in a program and actually it's a participatory program, what that really means is that, in order to get your benefit this year, you need to do this health risk assessment. That's a participatory program. You go in, you do what you have to do to get your health assessment. I guess when you start to look at that, they've stipulated how much of your benefit you could reward, but the biggest deal is that you can't discriminate, and employees need to have chance after chance after chance. So, for example, in one of the companies that I've worked in, if you were an employee at Berkshire Health Systems, for example, you need to come through, do a health risk assessment, get your flu shot, get a screening. In your screening, if you had diabetes, then we would not stipulate that you need to get your blood sugar under control. We would say that you need to go to a diabetes education program. If that diabetes education program is not going to be reasonable for you because you had a knee replacement, we need to accommodate that for you and give you every chance possible to meet the standards so you can get the premium reduction. So there's going to be more education coming. The brokers are really just going through the learning process for this now. So stay tuned, there'll be a lot more information. The bottom line is that we should not be withholding premiums or making premium decisions based on health risk factors. So you can't discriminate if somebody smokes or doesn't smoke. you can say you need to go to a smoking program, and if they quit, that's great. If they don't quit, you can't withhold the benefit. You need to do something else. Again, this goes into effect in January of 2014, and there'll be more education coming. I know that I've just seen a couple, National Business Group on Health has just kind of put together some programs and have started to kind of sit that down, likely through chambers. So stay tuned, you'll be hearing more about that. And so that's really what I have to wrap up now, and I've tried to keep it right to a half hour. So we can take questions after, and Lisa, I'll give you the floor.
I'm actually going to give the floor to Claire, and then I'm going to go after Claire.
So historically, most of the, I'm just going to stay seated, if that's all right, Valerie. Most of the literature around worksite health promotion programs have been done in much larger companies and employers over 500 employees. So when we are talking about small businesses, we've identified some clear best practices, key elements that support sustainable, successful worksite wellness programs. And I'm going to go over each of these in detail. So the next slide. So visible management support is one of the key components of a successful worksite wellness program. There really needs to be a wellness sponsor in the senior management level who's responsible for communicating the components of the wellness program to all employees, and particularly communicating it to the mid-level managers. You know, if there's a wellness program that offers, Bobby mentioned this, if you're sort of offering a lunchtime tobacco cessation program, but the mid-level manager either isn't aware about it or isn't supportive of it, the employee is not going to be able to take advantage of it. So senior management really needs to engage with mid-level managers and communicate the goals of the Worksite Wellness Program to all staff and managers. They're also responsible for dedicating a certain amount of staff and resources to the wellness program efforts. Particularly, there needs to be an identified wellness champion, and as Bobby mentioned, this really needs to be written into their job description so that it's not just added on top of somebody's existing workload, but instead for sustainability, this identified person, even if they leave the company, somebody coming in is going to be able to take on the responsibilities in a reasonable manner. One champion alone isn't going to be able to carry out the entire wellness program for the company, though, so there really needs to be a whole wellness committee, and ideally these would be appointed by senior management. We need to contribute, senior management needs to contribute to a supportive environment for the employees as well, so making sure if you're encouraging employees to be taking the stairs to get to their floors, stairwells need to be well marked and maintained and sort of brightly painted and well lit, clearly identified as an opportunity for employees to be taking those stairs. Any sort of worksite hazards in terms of safety and protection for employees need to be minimized or controlled. And then policies supportive of health. So I always like the idea of a healthy meeting. If you're trying to encourage healthy eating for your employees, and then you have, weekly staff meetings with donuts and pizza or something, then you're not really walking the walk and talking the talk there. So policies need to support the goals of the wellness program as well. Management really is responsible for creating a culture of health and carrying out these best practices. The next hallmark is strategic planning. Rather than just offering a lunchtime yoga session or diabetes prevention, you really need to be gathering data as the basis for a strategic plan of wellness to make sure that you are understanding the full needs and interests of your employees in order to cater the programming to those needs. We encourage employees in the wellness committee to develop a formal written plan where they've identified top health risks and what the goals of the program are, what the needs of senior management are, what the priorities are for senior management for the organization, and then really sort of writing out how those goals will be achieved with measurable objectives.